Great. So the call is now being recorded. So again, generally we record the webinars and the discussions, and we save them on YouTube to make sure that we can share them with other partners that weren't able to join us on the conversation live. But we still want to make sure we have this available for any partners that might be interested in the topic. So again, welcome everyone to the third NLAD network call. We've had two last week, or the year before that, I'm sorry, the week before that. And the topics were on general HIV and Latinos, looking to epi data nationally. And then the one after that was one we did in collaboration with the Latinos in the Deep South program. And that one was specifically about engaging media through press conferences. So we've had two so far. This is the third one we've had, and we're excited to get started. So I get some general housekeeping rules. The lines, again, are currently muted to eliminate some background noise. And you can see in a minute when we unmute the lines to do introductions, it can get a little crazy to hear. So we try to keep the lines muted to make it easier for everyone to hear what we're talking about. But if at any point you want to talk or unmute your line, you can do so by pressing *7. And then you can press *6 to mute your line again. And as always, you're more than welcome to use the chat function on your screen there, which is available for you to kind of chat with us and answer or ask questions, make comments, and we can address them as we go along. So a quick overview of today's agenda. We're going to do introductions, kind of get a chance to let everyone introduce themselves, let everyone on the call know where you're from and kind of what you do. We'll do some general NLAD announcements. And then we'll go into today's topic, which is on Latinos and PrEP, with our guest speaker, Michael Diaz, who's the Capacity Building Assistant Specialist here at the Latino Commission on AIDS. And then we'll do questions and answers. That's pretty much what today's quick call / webinar is gonna look like. And again, my name is Tony Ochoa. I'm the NLAB Program Manager here at the Latino Commission on AIDS. I'm the guy that's bombarding you guys with emails, kind of trying to get you guys to give you as many resources as we have available as we're developing them. So again, if you have any questions about NLAD, don't hesitate to send me an email. Things are a little crazy right now, but it's easier for me to get a response to you if you shoot me an email more than anything else, all right? So with that, I'm going to unmute the lines now, and if you can quickly just give us your name, where you're located, so your city and state, and then your organization, all right? So I'm going to unmute the lines right now.
The conference has been unmuted.
This is Steven Vargas in Houston, Texas with AMA.
Hey, Steven.
Javier Ortega, Santa Bárbara, California. Santa Bárbara Neighborhood Clinic.
Welcome.
Betsy Morales, Hispanic Federation, New York.
Hey, Betsy.
Hi.
Here's some music.
Ken Jesus from Iris House.
Hey.
Mirna con Y o...
Hey, Mirla.
This is Robin Rivera with the Department of Health and Human Services in North Carolina.
Welcome.
Hi everyone, this is Andy Fine. I work at Marin AIDS Project outside of San Francisco.
How are you doing?
I'm doing well,
It's a lot of background noise. Eduardo Nettle, Massachusetts Department of Public Health.
Hey, Eduardo.
And this is Sarah Grassi, the Marin County Department of Public Health.
Hey, Sarah.
This is Rodrigo Rodriguez from Wake Forest School of Medicine in North Carolina.
Hey, Rodrigo.
Marcos Sigala, San Isidro Health Center.
Marcos, how are you doing?
Very good.
I am Jerry Cantu from AMA in Houston, Texas.
Jerry. Else? All right, so I know there's several people on the call too that aren't speaking. That's fine. I'm sure we're multitasking, which is fine. We tend to do that when we're on webinars. So we're excited to have everyone on the call. And as you can see, the lines can be a little hectic when they're not muted. So we try to keep them on mute during the call. But like I said, if at any point you want to make a comment, what I'm going to ask people to do is there's a feature on your screen where you could raise your hand. And if you raise your hand, I'll call you out. I'll mention your name when I see you raise your hand, and I'll ask you to unmute your lines. You can do that by pressing *7, all right? So if you have a question or want to make a comment live, you can either use a chat box or raise your hand, and we'll figure it out, okay? So I'm going to put the lines back on mute until during the discussion.
Great, perfect.
The conference has been muted.
Great. So quick NLAD general announcements. Again, this year's theme is You and I Will Defeat AIDS, or in Spanish, Tú y yo vamos a derrotar al SIDA. And this was something that came about from a discussion that we pretty much had with partners. We did a good amount of soliciting feedback from partners nationally. We kind of ran it through our leadership council. And we asked them, what did we wanted to see? We had some feedback about the theme and imagery from the previous years. And people really liked, seeing actual people on the posters. So we wanted to make sure we integrated that and maintained that throughout the course of this year's poster. And the theme, similar to last year's, if you guys remember, last year's theme was Commit to Act. You see there's individual prompts under each one of the person's faces, and it really kind of speaks to several things, right? It speaks to how, as individuals, we can commit in different ways to defeat AIDS, whether you're positive or negative. And we also try to do things that address different things along the continuum of care, or things you might see highlighted in the National HIV/AIDS Strategy, right? So things like, testing. Testing is an ever-present component to the work that we do. Things around stigma, so we wanted to make sure we included the comment around, not being ashamed to talk about HIV. Things around PrEP. PrEP is a pretty hot topic right now. And if you notice, we didn't use the term PrEP. We kind of decided to take a step back there. We did some staging of knowledge around kind of where people are as far as understanding what PrEP is. And very few people don't really even know what the term PrEP is. So we wanted to take a step back and even just start defining it, right? So we gave it this definition of asking about the pill that prevents HIV, right? So that kind of starts speaking more about what it is as a medication rather than a strategy, and starts getting people talking about, wait, there's a pill that prevents HIV, right? So that's the reason it was worded that way. And then we also wanted to talk about maintaining medical care and treatment. So you see the last comment there was around medical care and treatment. So again, and another beautiful thing about this poster that we put a lot of thought into was making sure that we kind of present the diversity racially of what Latinos look like. So I think the collection of all those efforts really speaks beautifully to the way this was presented in this year's poster. So I'm very proud about what we developed this year for NLAD. We're excited about sharing it and having partners use it. And as you can tell, at the bottom of the poster, there's an area, as always, for partners to enter event information if they decide to use the poster as a publicity tool to market their events for NLAD. So yeah, that's kind of what we have here. The poster itself will be available for download on the NLAD website, and that speaks to the next comments, right? Well, actually here. The NLAD website is, we expect it to go live the first week of September. So generally, partners go to the website to download resources, order testing kits. This year, we're making a strong effort to make sure that we have a printed campaign kit. And the printed campaign kit would be mailed to any partners that request it. And it includes posters both in English and Spanish. And it has a set of resource guides that help partners in organizing their NLAD events locally. And testing kits would be available for order on the website as well. And you'll also be able to access and enter event information on the NLAD website once it goes live the first week of September. And as always, you'll be able to download electronically all the components that we have developed for the campaign, including the resource guides, the posters, the fact sheets, all those things that are going to help you do what you do locally. Right? And we'll be having our next, this is going to be the series of webinars and topics calls that we're going to have during the next couple weeks. The Latinos and PrEP webinar is the one we're going to be talking about today. The one after that on Thursday is going to be on Latinos and HIV testing. It's going to focus around effective engagement mechanisms for engaging Latinos for testing and testing technologies. Then we're going to talk about Latinos or Latinas and the Affordable Care Act at the end of the month on the 31st. That one's at 2 p.m. And then we're going to do a fourth one on getting the most out of NLAD, so making sure that, how do we effectively monitor what we do and make sure that we get the most out of hosting great events locally. So those are the lineups for our upcoming calls during the next couple weeks. We're excited about engaging partners and being on these calls and making sure that they're useful to you as possible. So are there any general comments or questions? What I'm going to do right now is I'm going to unmute the lines again, or you can enter your comments or questions on the chat box, okay?
The conference has been unmuted.
So the lines are unmuted. You're welcome to make any comments or questions. That's completely fine. We can go into our webinar topic.
Tony, this is Steve Vargas.
Hey, Steve.
I love all the topics. In fact, I think I put it in the last survey, basically the same topics I already have up. But I was wondering, is there any way we could incorporate some information on how the Ryan White program complements or assists people who have private health insurance? That's something we hear about here sometimes in the Houston area, is that sometimes there's a lot of private providers who aren't aware about the services that HIV can secure even if they have private insurance, like the Health Insurance Assistance Program.
Definitely try to include it during our ACA discussion around how Ryan White's the payer of last resort. So we'll definitely try to keep that topic in mind when we're having that topic around ACA and kind of how that fits into Ryan White.
Thank you.
Anything else? Any other comments around NLAD announcements or anything moving forward? Good stuff. All right. So what I'm going to do now is I'm going to introduce my colleague, Michael Diaz. I'm going to mute the lines again so we can kind of get the topic started.
The conference has been muted.
So today's topic is going to be on PrEP and Latinos. And my resident expert here is going to be my colleague, Michael Diaz. And he's going to walk us through kind of how PrEP works, where PrEP came from, and how it effectively would impact what we do, the work that we do with Latinos. Okay. So with that said, I'm going to pass the baton on to Michael.
So welcome everyone. Again, my name is Michael Diaz. I'm a capacity building assistant specialist here at the Latino Commission on AIDS. Basically, I provide capacity building technical assistance for different public health interventions and public health strategies and HIP interventions as well. So just, I guess just as a disclaimer, I wanted to start off by, mentioning that this is going to be part of an ongoing conversation that I definitely want to have with you all today. We're going to be talking about an additional prevention tool that looks promising for our communities, but it is really, really important to keep in mind that it's still up to us as providers and stakeholders to do the groundwork, right, of making options available and accessible to community members facing stark health disparities. All right. So today's conversation is really part of a larger community mobilization effort, right, focusing on key concepts involved in the implementation of PrEP with diverse Latino communities. And I definitely want to emphasize communities because we know it's not one monolithic community, and we know that it's up to us to know our community and to be able to customize messages and approaches based on our expertise working on the ground in the field. Okay. So with that said, I'm not going to spend too much time here. I just wanted to provide some context. Most of us were very aware of the statistics and how HIV affects and impacts our communities disproportionately, specifically in this case Latinos, right, among other communities. And I'll just highlight one data point here. In 2013, right, Hispanic Latinos represented 23% of the estimated new HIV infections, right, that year. And among those numbers, approximately 85% were among men. Within that same pool, 81% of that group was men who have sex with men. 15% were diagnoses in women, and a little less than 1% in children. Right. So again, this is the context and the relevant points in terms of why are we talking about PrEP today, right? As a potentially effective biomedical intervention, latest intervention, right? Excellent. So what is PrEP, right? Again, really quick. Pre-exposure prophylaxis, or PrEP, is a way for people who do not have HIV but who are at substantial risk of getting it to prevent HIV infection. by taking a pill a day. So right now, the pill is, brand name is Truvada. It's a combination of 2 different types of antivirals, tenofovir and entericidine, right? When someone is exposed to HIV through sex or injection drug use, these medicines can work to keep the virus from establishing a permanent infection, okay? Looking at the studies, when taken consistently, we know that PrEP has been shown to reduce the risk of HIV infection in people who are at high risk by up to 92%. So what do we know? So we know it works, right? Additionally, we know that full access to comprehensive PrEP services is an area of critical focus in the updated 2020 National HIV/AIDS Strategy, okay? And the language there even incorporates, in terms of who is this for, it describes it as it is for those whom it is appropriate and desired, right? So again, this is an additional option. There are, in terms of the screening processes, we each have those at our individual agencies, but this is about providing more options to people, right? And so we're going to sort of have a larger conversation about what that means with the folks that we work with.
So great. So on your screen now we have a poll question, and the poll question is for you all to take a minute to try to answer here. So the question is, who is PrEP for? And the options are men who have sex with men, heterosexual women, heterosexual men, injection drug users, and all of the above. So go ahead a second and fill out that poll. Select one of those options. Great. So we have about 16 people answering. Everyone's answering all of the above, which is a beautiful thing. It's a beautiful thing, and we'll see why.
Excellent. So who is PrEP for? Absolutely right. It is. So these are, you're looking at the CDC guidelines, which were released in 2014 for the document called Pre-Exposure Prophylaxis for the Prevention of HIV Infection, right? And it includes all of the above: men who have sex with men, heterosexual women and men, and injection drug users. All right. So we definitely see among some priority populations, we see some commonalities. For example, I'll just name some quickly: HIV positive, sexual partners, recent bacterial STI, right? High number of sex partners. Again, nothing surprising here. Some of the nuances with heterosexual women and men has an addition, sort of caveat, which is in high prevalence areas, right? We also have here injection drug users, right? Again, similar HIV positive injecting partners, sharing injection needles. Again, this is who it's for. And it's sort of in looking at this, it's also really important. We're going to have a larger conversation later about accessibility, right? So we know who it's for, but how do we make this accessible? How do we make this more available, right? But for those of us who work with with diverse sets of Latino community members, I also want us to think about sort of those intersectional experiences, right? So for those of us who work with women and who are also migrant workers, right, or drug users, as well as sex workers, and are also undocumented, right? So sort of like, how do these intersectional experiences, how do these contexts multiply barriers, right, for accessibility? And that's something really up to each and every one of us to sort of think about, and how it relates to the work and how it relates to the people we work with, okay? Excellent. Something also I want to just quickly point out is, the eligibility in terms of clinical practices, standards. Definitely important to highlight that there must, for a person to be eligible for PrEP, there has to be documented HIV negative status, okay? Also, no acute symptoms or no acute HIV infection as well, okay? And other types of clinical eligibility criteria, which is definitely important for us to know and keep note of. All right. So again, I'll go through this pretty quickly. This is a little more specific in terms of the guidelines, specifically here for recommended to MSM, right? So adult man without acute or established HIV infection, any male sex partners in the past 6 months, right? Not in monogamous partnerships with recently tested HIV negative man, and at least one of the following, okay? Any anal sex without condoms, any STI diagnosed or reported in the past 6 months, and is in an ongoing sexual relationship with an HIV-positive partner or serodiscordant couples, right? So some things here to keep in mind, adult man, usually 18 plus, and when referring to Q infections, referring to an infection established between 2 and 4 weeks.
Great. And one of the reasons why I was excited that everyone answered the poll question correctly is that we're very focused on making sure that PrEP is accessible to MSM. But what I think it's important for us to understand that it's not only for MSM too, right? We definitely have other reasons why it's necessarily being pushed over. Some MSM is a very high-risk population. There's also other reasons why it's not being emphasized with other populations as much, but it's still considered a pretty effective means of prevention when it comes to other populations as well, heterosexual men and women, right?
Okay, here we have the goals for PrEP therapy, okay, also part of the guidelines. And really quick, we see 3 bullet points, and you'll notice, right, educating patients about the medication and their regimen, also highlighting support for medication adherence, and also being aware of HIV risk reduction support, right, practices, strategies. Again, these are things we are already doing, right? The difference here is now that these concepts and these conversations are now in the context of HIV-negative persons, right? And 2 really critical concepts here to unpack with our community members is medication regimen, right? So what does that mean, right? It's a plan. Taking a pill every day. As it stands, the protocol is take 1 pill every day of Truvada, right? But even in that process, and we're definitely going to talk more about sort of accessibility, availability, but before we get into that, but even just the idea of taking a pill every day, is that practical for me as a community member, right? Is that desirable? Do I want to, right? Does it make sense for me based on my life context? And these are the larger conversations that have to be had between providers and the community members who are receiving these services. Again, PrEP does require commitment and resources. We're definitely going to be talking more about that. But again, it's beyond just taking that 1 pill a day. There are follow-up visits that are part of that regimen, right? Continued HIV testing, also continued STI screenings, right? Continued blood work, right? So, this is definitely the context of potential successful implementation of PrEP. So it's not just about providing the pill, right, the pill that prevents HIV, but also about the follow-up context, right? And how do we sort of address disparities that already exist, right? Because we already know that a lot of our community members don't have access to these services. So in terms of thinking about this potential intervention or PrEP as an intervention, right? Really quickly, I want to highlight 3 concepts that are very relevant in terms of thinking about the success of any potential intervention or public health intervention, right? These are accessibility, availability, and acceptability, or also as we well know as the 3 A's. Quickly, availability, right? It exists, and most often in time, this is the conversation that we have. We know that different interventions exist and they're available, but again, that doesn't mean that they're necessarily accessible or that they're acceptable, right? Accessibility here, of course, referring to, or some components referring to location, accessible in your location. Is it accessible to all without any sort of discriminatory practices or misconceptions, right? Is the information available? And we're going to have a larger conversation about this later on as well. And of course, is it acceptable, right? In terms of social norms, in terms of stigma, in terms of the information I have access to, is this an acceptable form of prevention or an acceptable tool that I can use in my community?
Great. And Rob Short just made the comment that there's definitely CDC indicators for heterosexuals in IDU, right? And we just mentioned those a minute ago on the slide here where we're talking about MSM, and we showed them next to the guidelines around heterosexual women and men, and guidelines around injection drug users too. So very true. Thanks for reminding us of that.
So some things to consider here in terms of availability. Thinking about adequate clinical capacity and delivery of PrEP, right? So like other types of interventions, public health interventions, and resources that we provide, we always have to think about, of course, having trained staff, knowledgeable staff, culturally competent staff, right? None of this changes. This is what we are already doing, and this is what we need to continue to do. But in this case, right, specifically referring to knowledge on PrEP or the pill that prevents HIV, right? And that's even one way. I'm glad that Tony brought that up because, clearly language is very critical and very important. So instead of just using the buzzword PrEP, actually saying the pill that prevents HIV can make some of this information more accessible, right? And that's just one way of many different ways that we can sort of facilitate access to information and to these different types of public health strategies. Among that, also something to note, in many communities, the availability of PrEP is still unknown. Of course, an exception, one example that we have here is from the San Francisco City Clinic, right? The city's main STI clinic experienced wait list of several dozen clients from 2012 to 2013, all right? So clearly there, again, there are exceptions because we also know specific parts of the country have more resources and also higher prevalence incidences, which is going to inform sort of these processes and these policies. But in general, there's still a lot of work to be done in terms of helping to raise awareness and helping people know that there is a pill that exists to prevent HIV transmission. Really quickly also, some key points in terms of accessibility and PrEP, some things to think about from the consumer in terms of accessibility. Issues around cost, of course, and awareness that can limit access to PrEP for certain populations. And we're going to talk a little bit about some resources that are available to address that. Prior knowledge of the drug, right, appears to be one factor also related to its uptake, i.e., for example, stigma around the pill. What does it mean? If are people going to think I'm HIV positive, etc., right? These are, again, concerns that have come up in the past. This is nothing new, but it's sort of like how do we, it's really important to set up spaces to have these conversations with community members about what this means, right? Frequent copays and lab work can take PrEP uptake and retention and can prohibit it for some, right? And from the service provider perspective, right, knowing and understanding the phenomenon of silence that exists between healthcare providers and their patients, all right, nothing new. So again, it's being able to have those conversations, and of course the cost associated with these types of interventions. Now, in terms of acceptability, right, this is sort of dealing more with ability to manipulate social norms. Keeping in mind, right, HIV-related stigma that has been shown to negatively impact HIV testing status, disclosure, and treatment, right? Individuals reporting feeling stigmatized because of the PrEP, right? Or are people going to think, or often messages, oh, this is for promiscuous folks. This is for people who have a lot of sex or sexual partners. And in fact, it's about, hey, this is an option. The issue is the HIV virus. The issue is not how many sexual partners necessarily, right, or the sex that I'm having, right? But beyond that, it's an additional option for those who want it. And this is sort of some of the language that people and conversations that people are already starting to have, right? Of course, thinking of lack of social support from key figures can affect PrEP uptake and adherence. Even some, having some medical providers, some doctors specifically, who still, are resistant towards this type of intervention, right? Who don't feel, for their own set of reasons, set of values, don't feel it right to prescribe PrEP for people who are HIV negative, right? And again, those are other barriers that are very, very important to address at the local level, for sure, and of course nationally. So again, in terms of thinking about acceptability, right? These are just some questions to assess with community members. Here at the Commission, we've actually done community assessments specifically with Latino men who have sex with men, okay? Because we really wanted to understand, what does this mean to that particular community, right? And some of the questions that were asked revolved around, do you believe that taking PrEP is an unnecessary risk? Do you think it is immoral? Do you think it promotes promiscuity? Again, because it It's important to recognize that there is some stigma, and it's also important to recognize different sets of values and how people are receiving these messages and what they're thinking about them, right? In a very sort of open and candid manner that allows people to say whatever they feel, and then you as a provider then have the opportunity to provide information and clear any misconceptions that may occur, right? Other questions that were assessed: what will be your doctor's reaction if you request PrEP, right? And what would your community say if they knew you were on PrEP, right? So it's about meeting people where they're at. It's about providing information, clarifying misconceptions, and again, in a method that does not reinforce stigma. So, all that being said, what can we do to empower individuals and community, right? So we know, right, many Latinos lack resources, access to health care, transportation, health insurance. There are cultural barriers. There's lack of documentation and high levels of poverty. So we know these social and physical determinants of health exist, right, and have not changed much because we are still a group, Latinos are still a group of people who are disproportionately impacted by HIV. Not the only group, but one of the groups, right? And so knowing this, it's about the work, is about continuing the work that we do, doing advocacy, right? Advocacy for access, right? So it's a new option, it's a new tool for prevention. So how do we talk about making this more accessible to our community members, right? It's about continuing those community mobilization efforts. It's about still providing culturally and linguistically appropriate services, right? It's about still being innovative and thinking about who we can collaborate with and work with towards helping to make this type of intervention more accessible, more available, right? And in cases acceptable for folks, right? It's about continued support. And I think these are definitely some of the barriers that we will continue to address. And in order to do that, we have a couple of set of questions, right? So knowing, I have a quote here by Dr. Kenneth Mayer. He's Director of Medical Research and the co-chair of the Fenway Institute at Fenway Health. And he said, uptake of PrEP will be slow until knowledge of past and ongoing trials become widely known in both the MSM community and the general population. So again, this highlights a point of awareness, and knowledge dissemination, right? So, will this observation change, right? Something to think about is how do we expand PrEP knowledge amongst both high-risk populations and healthcare providers? How do we increase acceptability of PrEP among healthcare providers? Equal access, right? Dismantling institutional and structural barriers. And there are some models that exist. Specifically, the updated strategy highlights some of these models, and there are also several resources that highlight models of like PrEP programs or PrEP accessibility programs, and we can definitely send you a list of those. Some of them are Washington State, Texas, the PrEP Access Project in Austin, New York State PrEP Assistance Program, and of course City and County of San Francisco have really excellent models. But again, these are some models and help us to sort of start the conversation and see what that could potentially look like, right? And again, the ongoing conversation and key concepts here is, again, addressing misconceptions, raising awareness, highlighting options, right? Highlighting options for people, and facilitating access. So this is part of the ongoing conversation of thinking about options, right? Having this option, this pill that helps prevent HIV, and how is it that we can then embed that into a larger conversation of HIV prevention tools, right? Knowing, HIP has, for the last 5 years, and will continue to do that, has highlighted, right, the effectiveness of a combination strategies, right? So things that we've already been doing, HIV testing, right, and diagnosing those who are undiagnosed or don't know their status. The use of PrEP, in this case now, PEP, prevention with people with HIV, HIV treatment as prevention, condom use, access to sterile syringes and needles. These are all different strategies that we have been using and we will continue to use, right? And now we have an additional tool, right? And so now it's sort of looking at what does this mean and what does this look like to have PrEP accessible to folks who want it, right? And the continued work in acknowledging and in knowing how to customize these messages and how to customize these different tools for our communities, depending on their needs, right, and depending on their everyday context. So many of you had a couple of questions in terms of safety and side effects. So I provided this briefly to review with you. Some general information, and I got this from the betablog.org, a great source for information. About 1 in 10 people in PrEP studies reported some nausea, stomach pain, or weight loss when they first started taking Truvada. However, this disappeared in most people after a few weeks. A small number of people had a decrease in kidney function that returned to normal when they stopped taking PrEP. Again, that's why it's really important to have regular blood tests to monitor your kidney functions while taking PrEP. There was reported some loss of bone density, thickness. It was also reported and seen associated with Truvada. However, these changes have not been associated with an increase in bone fractures. And also, less anxiety and worry associated with having sex. And I think this is one of those social, psychological needs that I still haven't heard enough conversation around, right? And I think it's really, really important to recognize from a sex-positive framework at a minimum to recognize that, the use of PrEP adds to that intimacy and also to pleasure and also to peace of mind, which I think has been absent from the discussion around sex and enjoying sex and able to do it safely. So I think that's one definitely side effect, social side effect that has been very interesting, and people will continue to add to that conversation as well. And of course, some models of accessibility. So of course, to get Truvada for PrEP, you will need a prescription from a medical provider. We know that Affordable Care Act requires all U.S. citizens have insurance, and under those guidelines, and Tony will there will be a larger conversation about ACA, and in that larger conversation, we can definitely get more into the details of what does that look like, what type of providers can help access PrEP or other types of medical services. But of course, income eligibility for Medicaid, online marketplaces, looking at different plans and seeing who provides coverage for PrEP. There is a medication assistance program who helps the uninsured access PrEP. And this is just one example I included of the New York State PrEP Assistance Program for folks who are undocumented. So folks who are undocumented can still qualify for PrEP in New York State through ADAP. And for additional information, again, this is new intervention. It's getting off the ground. Demonstration projects are ongoing. And so we can definitely, I wanted to provide here PrEP Watch, which is one of many resources that provides information on current PrEP providers nationally. And it also, there is some information about contacting ADAP office near you to find out more information about potential PrEP assistance programs.
Wonderful, Michael. That was very comprehensive in a very short amount of time. I got to give it to you. I don't think I've ever seen someone give that much detail on PrEP, from what it is, where it kind of came from, a brief history, and actually given in context as far as how it would look like from an implementation standpoint. And one of the great things that I want to commend you for using, and I think one of the best things about the way you kind of framed the discussion was the way in which you use the 3 A's, right? Oftentimes we think just because something exists that, it's going to be used. And we know from general just commercial marketing, it doesn't always happen that way. Just because a product exists doesn't mean the public's going to use it, right? And the same thing applies to interventions in public health, like PrEP, right? So the fact that you framed it in the 3 A's, in the context of the 3 A's of the availability, the accessibility, and acceptability, it's important for us to understand that in order for an intervention or a biomedical intervention to be used widely, these three things need to coexist in order for it to be even successful in a broader range. So this isn't, even though PrEP exists, it doesn't always mean it will be successful unless these three A's exist and are being met. And these three A's can look very different depending on the target populations that we're talking about, right? So the fact that you kind of put it in the framework of what does this look like as far as accessibility when we're talking about undocumented individuals, right? Or someone that might be a migrant worker, that's a transient person across the country, right? It's important for us to consider these things when we're talking about how PrEP would look like from an implementation standpoint. So, very well done. Thank you for that. What I'm going to do now is I'm going to unmute the lines, or what you can do, let's do it this way. If you have a question, why don't you raise your hand, and then I'll call your name, and then we'll ask you to press star 6 to unmute your line. So does anyone have a question or comment? You can raise your hand, or answer it into the chat box. It'll be up to you. So Stephen, you have a question. Can you press star 6 to unmute your line? I'm sorry, press star 7, Stephen, to unmute your line. Star 7. Star 7. All right, Janelle, try star 7. I see you raise your hand too, Janelle. Press star 7.
The conference has been unmuted.
I guess we're having difficulty with that, so I'm just going to unmute all the lines. Stephen, what's your question?
Okay, actually, the question is around, y'all can hear me now, right?
Yeah.
Okay, great. When Mr. Diaz mentioned that New York is covering PrEP through ADAP, I would really love how y'all went around getting that done, because that's something I just started having some conversations with a few individuals here in Houston about trusting and seeing what we could do about getting some kind of coverage through ADAP if we put it off for PrEP. And so, I'd just like to have an idea of what would the steps take then, and see if there's something to be duplicated here.
So again, that's not something that we at the Commission can take responsibility for. That's something that came from a larger effort at a citywide level to make that happen. And again, one of the barriers that exists as far as accessibility goes is that the fact that ADAP in itself looks very different from state to state, right? Access is going to look very different from state to state just because of the mere fact that ACA looks different from state to state. It's not the same thing across the board. And different local government and agencies have different protocols and procedures as far as how this would work from an advocacy standpoint. So I would love to have a magic wand and a formula to make it work across the board, but that doesn't necessarily happen, right? I think that's kind of where it takes a lot of our effort on the local level to make that kind of initiation happen, that conversation started from a larger perspective, and really start including stakeholders to make sure this is something that's relevant to what we're doing locally and really speaks to a shared purpose that we're having with our stakeholders involved. So that's a great point. I mean, I would love to kind of say this is how it's done, A, B, and C, and D, but it's a very difficult thing to do.
Right. Yeah. Okay, like I said, we've just started having some conversations here at the local level, haven't even gotten up to county, state side yet, just here at Houston primarily. So, yeah, but okay. And that's exactly our plan. Started with the local folks and grow it from there until we have folks that can make an impact at the state level.
Definitely, and I'm sure even now, Stephen, the place that you're at is probably a lot higher than some of the other locations that we've been having conversations with. So again, we're dealing with locations that have a very wide range placement as far as access goes.
Yeah. Thank you.
Oh, thank you. Janelle, what's your question or comment?
Hello?
Yes? Janelle?
Yes, my name is Ariana Lin. I'm from Fort Lauderdale. I'm from Translatina. And based on your presentation, I want to know, in your presentation, how you addressing transgender community, and the men have a sex with men or in the general population?
In terms of how is it addressing the needs of trans? So thinking about PrEP, And I'm glad you brought that up because, often conflate. We throw the trans experience with the MSM experience, and we know it's two very different things, experiences, and need to be addressed differently and separately, respectively, right? So I think at the end of the day, one of the things that we're doing here, and I've had this conversation with Tony, is about when we're providing platforms and tools to have these discussions about what does access to PrEP mean for community members. It's trying to address, well, you know what, we're not, right now it's being emphasized for MSM or men who have sex with men, and throwing in the trans experience in that, and knowing that is not, these are two very different things, and we need to be able to recognize, assess the needs of our community, who are the trans women, for example, that we are serving, that we are talking to, and how do you customize messages that are specifically addressing their needs, right? Because we're not going to say, recognizing that they're disproportionately, trans women of color, trans Latinas are disproportionately impacted by severe structural interventions, right? Income, poverty, racism, right? Transphobia. So it's how, recognizing that these concepts exist, but how do we start, beyond recognizing that part of the strategy, the updated 2020 strategy also prioritized and highlighted trans women or trans persons as one of the party population that we need to work with. So it's up to everybody at the local level, national level, to really highlight, advocate, and bring those concerns to the table.
Great. And definitely, I think one of the major accomplishments, I think, from a national, federal perspective, is that with the recent release of the National HIV Strategy, the transgender experience was something that was highlighted as something we need to address within the work that we do. So again, not put it under this mask of MSM, or put this experience under the mask of MSM, but really highlight the transgender experience as something that we should address in the scope of the work that we do as an individual experience, right? So that's a very good point, and I thank you for bringing that point up.
Very, very critical. Thank you. Very key.
Questions or comments?
Yeah, I have a quick question. This is Rob Shore from Broward.
One more time?
From this.
This is Ross?
I'm sorry, can you hear me?
Yeah, who is this?
My name is Rob Shore. I'm in Florida.
Gotcha, okay.
Quick question. I was exposed to this. So question for you guys, or whatever group might be doing this. But there's a great wealth of information on PrEP out there in English. Are you guys, or do you know of anybody working specifically to create or translate all of that wonderful information into languages for the Latin community, which I'm told includes more than just Spanish?
So we're definitely doing work around translating it in Spanish for Latinos, and one of the major programs that we're recently initiating is something that actually Michael is a big part of, and that's our camp Preparándonos, right? And it's a capacity building kind of mobilization effort in which we're doing a process in several tiers. We created content and curricula in Spanish, and we're working with service providers directly to talk to them about PrEP in Spanish. And then on top of that, we develop resources for them to be able to speak to their community members around PrEP directly. So we definitely have that, and that's something that's moving in action right now. And it's actually moving in action right behind me with my colleague who's working on that content himself. Is there anything else that I missed about that?
No, but so yeah, essentially it's creating, as Tony mentioned, it's curriculum, it's information, it's definitely in Spanish. It's really important to have culturally linguistically competent information, but also using those spaces to address all these concerns, right? So clearly issues of having deeper conversations about access, having deeper conversations about preventative measures, really having open conversations also about intimacy and sex, right, and the type of sex that individuals are having. So it's really, we try to be, again, holistic about sort of what are the different sides of people, and their context and their experiences, and what does it mean, and sort of how does PrEP potentially fit, right, as a preventative measure in that context. But we are definitely, have started those initiatives. And we'll actually this week we'll be doing a training relating or connected to the matter.
Right. So it's definitely something that we're initiating now. We've had a pilot process for this recently here in New York. We're going to be doing a second one very soon, and we're excited to be initiating that process a lot more nationwide in the next couple of months.
All right, that's great. It's what I heard at a recent meeting in the Latino community, which was news to me, was it's more than just Spanish, and I would throw it out to you guys that the Latin community speaks more than just Spanish. Portuguese was what was pointed out. I think other resources to reach other communities would be useful in the Latino community in general.
Definitely.
Absolutely.
That's something you want to hear. I mean, again, when it comes to developing content, it's more than just translating it, right? Oftentimes it takes a lot of process and time to develop content that's culturally competent, and it really addresses the needs of the populations we're working with based on how it's developed and how it's worded and how it's executed. So, very good.
Cool. Thanks.
Thank you. Any other questions or comments? Again, we will be sharing the presentation with you all. If you haven't had a chance to, we will be having our follow-up call, NLAD Network call / webinar on Thursday, and that one's going to be specifically around HIV testing technology and effective engagement strategies for engaging Latinos to testing. That's going to take place on Thursday at 3 o'clock, so the same time on Thursday. If you haven't registered for that, it should be in the same email you received this invitation for this one in. And again, thank you all for taking the time to join us this afternoon. You guys have definitely made this conversation a pretty busy one, so thanks for that. That was very engaging and for a webinar. So any questions, don't hesitate to contact me. My contact information is on the screen here, and we'll be speaking. Right? So take care, everyone.
Hi. Hello. Hi.
Hello.
Yes, my name is Rosalia Curvelo from Latinos in Action in Fort Lauderdale, Florida.
Hey, Rosa.
And, hi, how are you? I just want to mention that my husband was HIV positive. I am negative, and he already passed away, but I try to keep myself informed. And I was noticing at the webinar that it's not mentioned about that PrEP will be beneficial for couples like the way I used to be in our situation, for couples that are married or together.
We definitely mentioned that. It was in a slide where we described the different populations that are accessing it. We talked about men who have sex with men, heterosexual women, and under that category, we definitely highlighted that it was for serodiscordant couples. So when we say serodiscordant couples, Rosas, in the field of public health, we mean the case in which one person is HIV positive and one person is HIV negative. So they're definitely being had around the discussion when we're talking about PrEP, and that's definitely one of the things that highlights someone's eligibility for PrEP.
All right, thank you.
Thank you.
Thank you so much.
Tony?
So we're a minute short from when we intended to end the call, so wonderful. We managed to end the call right on time again. So if you have any questions, don't hesitate to contact me. Again, my information on the slide here, and we'll be in talk. All right? Take care.